Hi, good afternoon, everyone, and thanks for joining us. My name is Rebecca Golds, and I'm working at CDC on the COVID-19 response. I'd like to introduce you to Dr. Jay Butler, CDC's Deputy Director for Infectious Diseases. He'll be giving you an update today about what's happening currently with the COVID-19 outbreak and also be available to answer some questions. Dr. Butler?
All right. Well, thank you, Rebecca. Good afternoon or good morning, everyone, depending on where you are. So let's start with a situation update. I think everybody's become aware of the spread of the COVID-19 virus since its original emergence in Wuhan, China in December of this year. Over the past 2.5 months, the epidemic has progressed. The first 2 months, really China was the center of the outbreak, and Wuhan province and central China in particular was impacted. As of now, there have been over 80 confirmed cases in China and over 3,000 deaths. However, as of about a week ago, the number of cases occurring outside of China began to exceed the number of cases occurring within China, both because of spread of the virus around the world and also because the number of new cases in China has begun to decline. Outside of China, there's been cases reported now from some 85 nations, of course, including the United States. Overall, over 10,000 cases have been reported from outside of China. The hotspots currently are in the Republic of South Korea. Also, a number of cases have been reported with community transmission in Japan. And then the two other regional hotspots are Europe, particularly with cases emanating out of outbreaks that were occurring in communities in northern Italy, and also the eastern Mediterranean region with cases emanating from Iran, particularly the town of Qom. Here in the United States, the number of cases has increased over the past several days, with reports of cases from 13 different states. The cases, the instances where there's been community transmission have primarily been on the West Coast, but not solely on the West Coast. And I want everybody to recognize this is a very fluid situation, and as testing becomes available through an increasing number of state labs, as well as in the near future commercial laboratories, we anticipate that the epidemic will continue to be recognized and spread will be better defined. The issues that I think are of greatest concern to us right now are spread to people who are more vulnerable for severe illness. There has been cases in a long-term care facility in the Seattle area where there have been 8 deaths associated with infection. The illness itself is one that's primarily a respiratory illness, as we know more about the manifestations. We also know that most people, about 80%, have relatively mild illness. Although it may involve pneumonia, the majority of people actually do recover. Yet there's still about 20% that have more severe illness that may require medical care or hospitalization. Mortality is an area of great interest to us because as we assess the impact of the epidemic and what are the appropriate interventions and considering both the risks and benefits, we want to know how transmissible it is and how severe is the illness. You've probably seen reports in the media saying that the COVID-19 virus is 200 times more fatal than influenza. I think that's probably a biased statement because we have less visibility on the milder cases. Our estimates suggest that it's probably less than 1%. But keep in mind, if this is a virus that is capable of infecting the vast majority of people, that's still a very, very significant number. The people who are at highest risk of severe illness are those who are elderly and also those with underlying illnesses, particularly chronic heart and lung disease, as well as diabetes. The interventions to date have focused on ways that we could limit entry or delay entry of the virus into the country and limit its spread. Those are interventions designed to buy us more time to be able to be prepared for the entry of the virus. And as we move into a time of progressive mitigation, recognizing that community spread is occurring in some locations, again, the focus is on how do we spread the impact of the epidemic over as long a period as possible so that businesses can remain open as much as possible, and so that the impact on healthcare is not going to be overwhelming if it can be at all avoided. This would also give us more time to develop effective antiviral medications and ultimately to have a protective and preventive vaccine. Even though it may be possible to have a vaccine that's ready to enter human trials over the next 2 to 3 months, because of what's required to show that the vaccine would be safe as well as effective, I think it's unlikely that we'll have a vaccine for the general population in less than 18 months. There is also a wealth of information that's available on the CDC website that I wanted to call attention to. There are guidelines specifically focused on businesses, how to be prepared. I think the important take-homes from that are issues related to HR and making sure that employees are able to stay home if they are sick. That will be to your benefit as well as your workforce benefit as well as your customers. And then also, particularly if you're in the public service sector, being able to provide hand hygiene products so that whether that be reminding people to wash their hands or providing gels to sanitize hands as much as possible, those would be things that we would recommend. There are a number of other guidelines that are available on the website. I'll just highlight a few of those that are new. There are guidelines, interim guidance on large events that is for COVID-19. Also recommended precautions for preventing the spread in election polling locations. Prevention of spread in communities, interim guidance on public health communications for communities, additional resources for healthcare facilities. There are strategies for optimizing the supply of N95 respirators, which I think is of particular interest to healthcare providers in the healthcare industry. Strategies to prevent spread in long-term care facilities, which I think is an area of keen interest given the concentration of high-risk individuals in these facilities. Interim general guidance for healthcare facilities, also guidance for institutes of higher education, including specific guidelines for students wanting to study abroad. There's also some household readiness guidance and some documents on combating stigma, and also frequently asked questions for children. So I think I will stop at that point, and I understand there is a queue of questions already to go, and so I will turn it back over to Rebecca.
Okay, sorry.
I think Rebecca is
I am here.
Okay.
Sorry, yeah. The first question we got in advance was, we heard there's ongoing research on the lifespan of the virus and how it lasts on surfaces. Could that change the cleaning requirements? Because right now the website says that there's no need for deep cleaning or extra cleaning measures. Is that going to change?
You know, of course, this is a broad answer to many questions, as we're still learning about this virus, but what we know about it so far would suggest that the routinely Touched surfaces can be cleaned with the cleaners that are typically used, and these would be using products according to the directions on the label. We do not have recommendations for specific PPE for prevention of infection of people who are doing the cleaning, but of course the PPE, whether that be gloves or eye protection that are appropriate for the cleaning solution itself, is important to continue. The survival of the virus on surfaces is one of great interest to us. Right now, the epidemiology, as well as what we know about other coronaviruses, suggests that it's primarily spread through respiratory droplets, meaning droplets that are not airborne but may be projected during coughing or sneezing. But there is some experience, particularly with the SARS virus, that suggests that surfaces could become contaminated and that the survival of the virus could be for a period of minutes or hours, and that it could be potentially transferred, usually through hand contact. So that's one of the reasons why we have such a concentration on hand hygiene, as well as breaking the very difficult habit of putting your hands to your face. There have been a number of projects assessing the viability of the virus on surfaces, and I think that backs the current recommendations. However, it's important to recognize that some of this research has really focused on what are the outer limits under absolutely ideal conditions, which even may be unlikely to achieve in real life. So if you hear of contaminated surfaces and virus being recovered for a period of days, that may indeed be possible. What we don't really have evidence for is that that's a significant mode of transmission. Questions have been raised about whether or not mail and packages could become contaminated. Also questions about money. You know, right now the epidemiology does not point towards that, particularly as we talk about the mail. We would have seen more, I think, metastatic infections very early in the epidemic, given that China is very interconnected with the rest of the world and is a major exporter of products and a number of different goods. The epidemiology of the spread out from China has almost been exclusively through travel to China, exposure to someone who is symptomatic, and then exposing other people after return. So in terms of specific products, it's kind of the routine things in terms of sodium hypochlorite, meaning bleach-type products, or alcohol wipes.
Okay, great, thank you. Do we know if recovered patients are still capable of transmitting the disease?
Yeah, so it appears that the people who are most infectious are going to be the people who are actively ill. And some of that is just common sense in terms of persons who are coughing and sneezing, of course, are having a harder time controlling their secretions and more likely to transmit it to people around them. There is some evidence that people are shedding the virus shortly before the onset of symptoms, and there is also evidence of asymptomatic infection. At this point in time, we have very limited evidence that those asymptomatically infected people are playing a significant role in transmission. But we are very concerned about that possibility, and we continue to monitor it very closely and continue to collect data. For people who have had documented COVID-19 infection, our current strategy is to have those people isolate, whether it's in a healthcare facility or self-isolation at home, until there have been 2 negative tests on consecutive respiratory specimens. And this is usually a swab up the nose and also in the throat through the mouth, and that both of those tests would be negative on 2 different occasions, at least 24 hours apart. There have been some isolated instances of tests collected later that were positive, showing a very low viral load, and at this point in time, we're still determining what the significance of those tests are. The PCR is a very sensitive assay, and I think that's important for everyone to understand, particularly at lower viral loads. We're detecting not so much a proven viable virus as certain pieces of the genetic material of the virus, and that genetic material certainly could still be present even after the active infection is cleared.
Okay, great, thank you. What are the other things we should be doing to prevent the spread of COVID-19 that are different from what we're already doing to limit the spread of flu? So, for example, we know to wash our hands, we know about general sanitation. What additionally should we be thinking about doing to prevent COVID-19 spread?
Now, well, Rebecca, thanks for bringing up flu, because first of all, although this may seem a little counterintuitive, it's important to get flu vaccine. The ongoing assessment of the flu vaccine effectiveness this year is about 50%. That is a significant 50%. So, you know, if you can reduce your risk of flu by half, that's a good intervention. It also then provides less protection against flu. Not only can protect your health, but also help make the healthcare system more robust by avoiding a big influx of people with influenza. The influenza activity right now is at a peak, and this is actually, even though a lot of the focus has been on the COVID-19, this has been a bad flu year. We started out with early flu activity caused by influenza B, and as that was declining, influenza A, H1N1, basically the descendants of the 2009 pandemic strain, had a comeback also. So this has been a double-header flu season so far, and this second peak is actually much worse than the first. So there have literally been tens of thousands of people who have died of influenza this year. So those are, in many ways, many of those are preventable deaths through vaccination. The other things that can be done, you've already mentioned hand hygiene, but then it also comes down to issues like avoiding people who are sick. We more and more are doing what we call the pandemic handshake around here, which is bumping of elbows. People may have also seen some of the news that in France, the government has suggested that people suspend the practice of the kisses on the cheeks to be able to limit that amount of contact. And lastly, for people who are at highest risk of disease, they may want to consider whether or not they're attending mass gatherings. There are in the works some other guidelines from the CDC, including for faith-based organizations, and a number of those organizations have already taken steps to minimize the amount of face-to-face contact as well as personal contact during services and other religious activities.
Thanks, Dr. Butler. Can you please clarify whether the CDC is recommending self-isolation for 14 days after return from any country with a level 3 travel advisory, or is that still only applicable to travelers from China?
So this is a good question, because it displays the fluidity of this situation and how the recommendations are transitioning to the global aspects of the outbreak. So I think the short answer is keep an eye on the CDC website. Currently, the recommendations for what we call level 3 countries, meaning we would recommend for health reasons to delay all non-essential travel, are continue for China, but in the past week have now also included South Korea, Italy, and Iran. There is a level 2 recommendation for Japan, where we recommend for people who are at highest risk or most vulnerable also reconsider travel.
And are people still being screened at the airports? Are they screening for flights that are returning from South Korea or Italy? And are those people being told to self-monitor and or self-isolate?
Well, at the national level, the screening is still for the flights arriving from China. The steps being taken to address limiting importation from other countries are evolving fairly quickly. We recognize that the whole process of traveler restrictions is a cost-benefit process. We want to minimize impact on travel and personal freedoms as much as possible, also recognizing that there is a significant economic impact as well as personal impact on limitations of travel. The caveat in that is that some of the states that have not yet had any community transmission have encouraged self-isolation or self-quarantine, actually, for people who are returning from these high-risk countries. And it's important to recognize the way the public health enterprise in the country works is that oftentimes the actual implementation of public health is at the state or local level.
And what does CDC recommend as a good source of information to help companies and businesses decide whether they should isolate or quarantine individuals who have traveled or possibly been exposed to either flu or COVID-19?
Well, I'll certainly use that as a chance to plug the CDC website, which you can Google CDC and coronavirus, and I bet you'll get it, but also cdc.gov/coronavirus should take you there. And there's a whole wealth of information. And I think I mentioned earlier some of the guidance for businesses. And, if you have comments on that, we would actually welcome that. So I wanted to make sure that people were aware that we want to make sure that we're providing guidance that is practicable and as helpful as possible. Our goal is to have science and evidence-based guidelines, and the science is quickly evolving, so they may be subject to change. So I'd encourage you to keep that site bookmarked and keep an eye on what some of the newer publications that show up on that website are.
Thank you. What's the best practice for a company? Should an employee report flu-like symptoms after travel? Should they close the office and have the staff work from home until lab results come back? If a family member of an employee reports symptoms, what's a company's recommended course of action?
Yeah, so that's a really good question. So the first and most important step is to make sure that anybody who is sick goes home, or if they're seriously ill, that they contact their healthcare provider. But you want to be able to separate those who are sick from those who are not sick to minimize the transmission. I think the words I used were contact a healthcare provider, because we don't want people just to show up in the clinic and potentially sit there for a couple of hours coughing or be in the emergency department. We want them to be able to have an interaction with a healthcare provider so that they can be advised of the best way to come see a healthcare provider if that's necessary, and so appropriate infection control measures can be in place. If you have an employee who's confirmed to have COVID-19, I want to just remind everybody that there are issues related to personal health care information, and so be sensitive to that. Your HR offices may be able to provide you some guidance on that. And in terms of whether or not that means businesses should curtail activities or potentially close, those are really critical questions that have to be made on a case-by-case basis. So that's where it's very important to contact your state or local health department for ongoing advice, and also you can contact CDC as well. But do keep in mind that you have those local resources as well.
Okay. Is there an infection matrix or any sort of guiding numbers of infected people in the population that would indicate a recommendation to maybe close schools or cancel public events?
Yeah, another really good question. So ultimately, whether an event is canceled or not depends on the situation and ultimately will be determined by the state or local health authorities. That's where the legal jurisdiction to be able to do that sort of thing lies. The role of CDC in that is to be able to provide guidance to the state and local authorities and to help them with some of the preparedness activities to be able to do that. So it really comes down to the specifics. Yesterday, CDC posted mass gathering guidance on our website, which is intended to be a guide. CDC does not have legal authority to cancel local events or to close schools, and that would not be appropriate anyway because these are decisions that really need to be made locally. Ultimately, we may see that this epidemic impacts all parts of the country, but right now it is not all parts of the country, and it will be not all over the country all at once, most likely. In some ways, it's kind of like the flu. We see how influenza season starts usually in certain locations and then begins to wane as it continues to increase in other areas.
Great, thank you. And if we're traveling and we see someone with symptoms, who should we report that to?
So it really depends on the situation that you're in, but it's, you know, traveling is a very broad point, whether we're talking about airports or on board a ship or on an airplane. Probably the easiest one is if you're on a cruise ship would be to alert the medical staff on board the ship. I'm sure if anyone's traveled recently, you've seen a lot of people wearing masks. I anticipate that's something that people may be wondering about because that's a question we get a lot. The CDC currently does not recommend use of masks in community settings because of really limited data that suggests there's any benefit of that. If someone wants to wear a mask, you know, I think the biggest concerns are twofold. One is just the limited supply of masks that are available. But second of all, just anecdotal observation by one Jay Butler is I've just noticed how many people who are wearing masks keep reaching up to their face to adjust it. And just 2 days ago in an airport, I watched someone on the escalator who just continually took their hand from the handrail and took it to their face to adjust their mask back to the handrail. So, you know, there certainly is, it's conceivable that they actually could increase your risk of being exposed to respiratory viruses, possibly including the COVID-19 virus.
Thanks. I got the question that originally we were advised to screen for travel for the past 14 days, and we're now seeing reports of incubation up to 27 days. Which is correct?
Yeah, so the vast majority of cases where there is a discrete exposure fall in the range of about 4 to 7 days. The outer limits are mostly in the range of 2 to 14 days. Just the observation of the various reports and interpretation of what's being published in the scientific literature is those instances of the outliers that are much longer than 14 days are mostly in settings where, one, there's a lot of community transmission and it may be very difficult to isolate just where exposure occurred, and two is in situations where the information for the possible exposure is being obtained through things like medical records review, which I can say as a physician, we don't document in the medical record everywhere someone has been and every sick person they've been around in the last month. So I think that's a very undependable source of information. So at this point in time, we feel like the 2 to 14 days is going to capture the vast majority of cases when we're looking at what is the most likely incubation period.
Okay, and I know that your schedule is requiring us to actually wrap this up early, but for the last question, I just wanted to ask, what's CDC's guidance on banning travel or restricting non-essential travel to specific countries?
So again, the approach to this is to avoid limiting movement as much as possible, but striking that balance between what are the risks and benefits of limiting travel. This is an area that where we continue to evolve very quickly, and again, the level 3 guidelines, which really do recommend delaying all non-essential travel, focus on China, South Korea, Iran, and Italy.
Great, thank you so much. And thank you everyone for joining our call today. If we did not get to your question, please check our website, cdc.gov/coronavirus. We have a feeling the answer will be there, and keep your questions coming and we will try to answer them. And thank you for your patience and for your attendance today.